So let's talk a little bit about the vision for Ivaran in terms of, a common data layer across the different software platforms that are operating there. What is the level of interoperability going to be like?
Yeah, so there will be full interoperability, but I think even before we get there, I don't think we can understate the value in consolidating systems just from an operational perspective. I mean, providers need to do, technology risk assessments. They need to, assess security posture of their vendors, setting up and managing logins and users, whether that be through SSO or something else. So even just before you get to those downstream benefits of the data coming together, there are a lot of operational benefits to having, one consolidated organization that can serve a lot more of your technology needs. After that, when we start to talk about, well, what are the future benefits? Well, I think that's where that's something I'm really excited about. I think there's tremendous opportunity to start to bring data together around sort of what's happening at the individual resident level, bring that together into predictions about the future for that home, helping groups to maybe understand where risk exists in their organizations, and then within the organization, right down to the individual level. So across the, using some Australian data at the moment across health metrics and MOA, we've been able to build out prediction models. So what is the probability that someone will experience functional decline next quarter? And we use current information and status about that individual person. And then we can aggregate that up. So as someone in governance, I've got a really macro view around how much risk exists across different locations or different homes. And then if I'm at the service level, that data gets translated to me in terms of what risk profile does this individual person have, but also what are the risk factors that are driving increased or decreased risk within that person, because some things will be protective, of course. Women tend to fall less than men do in a care home, so being female in that instance is protective.
And for the individual service user, mapping their journey perhaps from home care to retirement living to care home, where are we at in terms of interoperability for them? So a single care record that is shared across different agencies.
Yeah, so there's certainly that is an underlying objective of what we're doing here and bringing these systems together to make that information journey more seamless. So that is part of, I guess, the pitch for Ivaran to bring those things together so that as people move through their care journey, their information flows through as well.